tonight, President Trump aims to slash spending, cut back on Medicaid, and provide tax cuts in a budget bill that he calls the Big Beautiful Bill. 7 News reporter Gage Kilborn tells us more about what's in the bill and how one U.S. senator says it's a bad bill for New Yorkers.
The One Big Beautiful Bill Act is President Donald Trump's budget centerpiece. One part of it aims to make cuts to Medicaid. Republicans insist those cuts are to eliminate fraud, waste, and abuse, and will not result in lost coverage for those who need it. The nonpartisan Congressional Budget Office estimates the cuts to Medicaid could increase the number of people without health insurance by at least 8.6 million by 2034. U.S. Senator Charles Schumer is blasting the bill, saying in the 21st and 24th congressional districts, which include the Tri-County region, 75,000 people are at a risk of losing Medicaid if the Big Beautiful Bill passes as written.
Here's the big, ugly truth on this so-called Big Beautiful Bill. It would cut health care, would enact the largest cut to Medicaid in all of American history.
The cuts to Medicaid would mean no funding to clinics, which perform preventive care like birth control, at places like Planned Parenthood. According to Planned Parenthood North Country CEO Crystal Collette, half of their patients use Medicaid for insurance.
Medicaid dollars go to fund essential family planning care, family planning services, and that is preventative care that keeps folks healthy, participating in the work environment, educating themselves, caring for their families. So really what conservatives are looking to do is to attack basic health care that keeps our communities healthy.
Assemblyman Scott Gray fears if there are any cuts to Medicaid at the federal level, and the costs will be kicked down to the states and local governments.
The top line in our budget was extensive, right, and very high. So, and we knew federal cuts. I mean, everybody could predict federal cuts were coming of some sort, and there was going to be a gap in our funding for Medicaid programs. So, it's going to be very difficult to figure out how do we fill that gap.
The bill also would reform the Supplemental Nutrition Assistance Program, or SNAP. The bill would pass on some of the costs of the program to states. A House vote on the bill could come Wednesday morning. Gage Kilborn, 7 News.